This segment is sponsored by GBMC Healthcare.
Cancer of the uterine lining, known as endometrium, is the most common type of uterine cancer. Joining us to talk about endometrial cancer from GBMC is Dr. Kimberly Levinson, Director of Johns Hopkins Gynecologic Oncology at GBMC. Welcome to the show today, Doctor.
Thank you so much for having me today.
All right, now tell me, what is endometrial cancer and what are the stages?
Yeah, so just like you said, this is a cancer that starts in the endometrial lining. The endometrial lining is the lining that builds up and sheds every month during a period for premenopausal women. But in postmenopausal women, where endometrial cancer is the most common, you can get thickening of that lining due to a cancer or a precancer there.
Right, now...
Just like... Go ahead.
No, go continue. I'm listening.
I was just going to say, you'd asked about stages, and in terms of stages, just like every other cancer, staging basically means where is it? So just like we know that this cancer starts in the endometrial lining, staging has to do with if it's traveled anywhere else.
Oh, okay. So this is a kind of personal topic for me because I just lost my mom last month to a type of uterine cancer.
I'm so sorry.
Thank you. And now we don't know, like, what does it stem from? What are some of the causes and symptoms of endometrial cancer?
Yeah, so that's a really good question. So, there's a couple of different things that we can kind of find are associated with endometrial cancer, but sometimes endometrial cancer is just sporadic. And so, we don't know necessarily what the cause is. The most common thing that endometrial cancer is associated with is obesity. And we know that that's because of excess estrogen. So estrogen stimulates that uterine lining, and then we don't have the balance of progesterone. So you get buildup of the lining despite, being postmenopausal, and then those cells can become abnormal. Endometrial cancers can also be associated with some types of genetic syndromes, and we check for those in pretty much every endometrial cancer patient.
Okay, now how do you know when it's time to see a doctor?
Yeah, so this is probably the most important question, and I think probably the best thing that we can do here is anybody who has bleeding in the postmenopausal setting needs to go see their doctor for a workup. There's a lot of postmenopausal bleeding that is not due to cancer, so it doesn't need to cause 100% alarm, but really any postmenopausal bleeding should be worked up because this really is our opportunity to identify endometrial cancers early and then hopefully cure them.
Wow. Okay. Well, thank you for that info. Again, another personal thing for me. And I appreciate all the info you gave us today. Thank you for joining us.
Absolutely. Thank you so much for